So this is very important downstream work after CAR T cells. So the focus was that in our KARMA study, which is where the ide-cel, which is the CAR T cell, patients received that, 128 patients. This work is published. Now, the current presentation was on patients who relapse from receiving ide-cel. How was their response to subsequent anti-myeloma therapy? How well do they do after relapsing from CAR T cell? And the whole purpose was that the CAR T cells, patients who go on CAR T cells have such an advanced disease that they may not have a very much benefit to any subsequent treatment. So we had a median follow-up in our study was 19.9 months, and we had 68 patients who received subsequent anti-myeloma treatment following relapse after ide-cel treatment. The rest of the patient either did not get any treatment or did not want any treatment. So the 68 patient is our denominator for evaluating the vaccine response. And what we observed, now patients received all various types of subsequent treatment, from corticosteroids to proteasome inhibitors, which was given in around 69% of the patient, alkylating agents like cyclophosphamide, 45% of the patient, immunomodulatory, 45% of these patients, monoclonal antibodies, 44%, and then few other choices. So they got all assorted combination of treatment. And when we look at this, patients who received, if we take all the patients who received subsequent anti-myeloma treatment, the PFS2 was 13.61, which is quite impressive for this patient population. If we look at patients who got basically anti-BCMA treatment, the PFS2 was 15.5 months, suggesting that they were still responding to BCMA as a target. The target is still there, and that's a very important information. If we look at overall survival, 24.8 months, 2+ years after relapsing from BCMA CAR T cells, and anti-BCMA treatment, 31 months. So very impressive result were observed in these patient populations. So the overall summary was that overall response to any subsequent treatment for all treatment combined was 76%. Specifically, anti-BCMA subsequent treatment was overall response was 90% with 54% CR rate. So quite interesting responses were observed here. And so to summarize, the PFS2 in subgroup of patients who received some subsequent treatment was quite impressive and interesting, that the subsequent treatment do work, including subsequent BCMA targeting treatment. Various classes were used, and each of them had efficacy to a good extent. The differences in PFS1 versus PFS2 among patients who received the anti-BCMA subsequent treatment was similar to that PFS that we would observe in non-CAR T anti-BCMA therapy. So it did not change. And the bottom line of this was that there were very few patients when they relapsed after an ide-cel were BCMA negative. We had reported one case of biallelic deletion. There's another case reported. But out of all the patients, only 3 of the 71 patients were negative for BCMA. And so BCMA continues to remain a good target, and we can utilize this for treating the patients once they relapse from their CAR T cells.